Right now at 6 o'clock, Governor Holcomb says that he plans to extend the public health emergency order through the end of the year. The governor said that he would only end the public health emergency if state lawmakers passed a bill that would do three things. They are a continuation of federal funds for food assistance and Medicaid expenses, as well as extending the ability to vaccinate children ages 5 to 11. State lawmakers held a public hearing yesterday on a draft bill that would do that. It also included language that would stop businesses from issuing vaccine mandates. The General Assembly was scheduled to meet Monday to vote on the bill. Today, House and Senate leadership decided against that and will wait until January.
One reason for the delay may be a rise in coronavirus cases here in the state. Take a look at this county COVID metric map from the State Health Department. There are now 11 counties in red, up 5 from last week. That indicates the highest level of spread. There are no blue counties and only 8 counties in yellow, showing the lowest level of spread. The majority of counties, 73, are in orange. The number of hospitalizations is up 359 from a week ago and above 1,800 for the first time since October 6th. Help is on the way for a handful of Indiana counties running low on supply of pediatric COVID-19 vaccine doses.
News 8's Camila Fernandez reports on relief that comes just in time for the holidays.
The Boone County Health Department says approximately 2 weeks ago, they ran out of COVID-19 vaccines for kids 5 to 11. They've now recently received 700 more doses.
So we have been getting calls from parents who were concerned like, hey, are you going to have enough by the time my kid has this appointment coming up next week? And we will.
The Hamilton County Health Department says it expects to receive more pediatric doses next week. The Boone County Health Department says it also expects to receive more pediatric doses.
Our clinic will be open next Wednesday and Thursday, and I'm already seeing that we have over 100 people booked that day or on those days.
The Madison County Health Department says they also received 700 additional doses last week. Former U.S. Surgeon General and Wish TV medical expert Dr. Jerome Adams is encouraging everyone to get vaccinated. He says the vaccine's benefits outweigh the risks for these children.
We can live with this virus. We can have a sense of normalcy if everyone does their part, and it starts with getting vaccinated.
Both the Marion County Public Health Department and the Hendricks County Health Department say they have not yet experienced a shortage of doses. Camila Fernandez, Wish TV, wishtv.com, and follow us on Facebook.
Now to iTeammate, and new federal data shows that Indiana has only waived a little over $35,000 in unemployment overpayments this year.
Now that's compared to the millions of dollars waived by surrounding states. iTeammate's Jasmine Miner is digging into this for us tonight.
Well, guys, when you think about the amount of people that are being asked to pay back $7,000, $8,000, $9,000 back in unemployment overpayments, that $35,000 that's been waived for the year could maybe only be a dozen cases at most. And while the state has been making progress in waiving those payments, they're still behind compared to surrounding states. Now, according to data from the United States Department of Labor, in the first few months of the year, no overpayment was waived in Indiana. 3 months later, only $412, and then a big jump happened this fall where DWD waived over $34,000. But if you compare those numbers to places like Ohio, who's waived over $10 million in overpayments, that is a big difference. Senator David Niezgodski feels Indiana is very behind on this. He says there needs to be more money put in the budget to update what he says is a slow system by the Department of Workforce Development.
We have heard that the system is outdated, that it's antiquated, and that's part of the reason of the slowdown. But I have to be honest, I've heard that the system is antiquated for a very, very long period of time. If we haven't been given all the ingredients to put together to make a recipe where we can become much more efficient just because of all the problems they had faced, then it's really upon us that would be, in my eyes, that'd be failure.
Well, I did reach out to the DWD on why more unemployment overpayments haven't been waived, and I did not hear back just yet. But a spokesperson for Senate Republicans tells me they aren't aware of anyone working on this issue right now, but that could change as they get closer to session. I'm Jasmine Miner for Wish TV, wishtv.com, and follow us on Facebook.